Good evening to you. I'm Karen Larson, live at Hillcrest Medical Center here in Midtown Tulsa. In a special edition of 2 Works for You at 6, we are talking with frontline healthcare workers who are dealing right now with the surge in COVID cases.
The entire state is essentially in Tier 3, which means that 20 to 39% of the available staffed beds are occupied by a COVID patient.
And as the COVID-19 cases keep rising here in our state, we are working for you, breaking down the numbers that are impacting our healthcare system and how the state is responding. Tonight, 2 Works for You's Aaron Conrad shows us where we are now.
Karen, when it comes to breaking down hospital capacity, it's pretty tricky. Capacity can vary daily, even hourly. But overall, COVID cases in hospitals are going up, and beds are few if and when they do become available.
Patients are very hard to treat.
Matt Stacy is the COVID-19 surge plan advisor to the Oklahoma State Department of Health.
We work closely with the Oklahoma Hospital Association, who represents the majority of the hospitals in the state, to develop that plan, and directly with the hospital CEOs to decide where those tiers are in those interventions.
Right now, the state is in the middle of its Tier 3 surge plan. That means hospitals are to cut back on some surgeries, and specialty surgical and post-acute care facilities can accept patients that don't need immediate care. This tier also allows the state to request a catastrophic health emergency and gives the governor the option of issuing an executive order reducing elective procedures by half. So far, the governor has not made that order.
As of today, hospitals are still performing elective surgeries and continue to be able to do so.
The concern, reducing other types of medical care, could impact the overall health outcomes for Oklahomans in the future. Coy Wilson and his wife spent nearly 24 hours in a local ER last week. His wife suffering from COVID-like symptoms. He tells us they waited for 12 hours before finally seeing a doctor.
They were already saying that there was no COVID beds available, COVID beds is what they called them.
Fortunately, Wilson's wife tested negative for coronavirus, but he says the reality they were faced with at the hospital was concerning. St. Francis currently treating an all-time high of 269 COVID patients within its hospital system. Hillcrest Hospital treating a record high of 132 COVID patients as of last week. The hospital operating near 98% capacity. OSU Medical Center telling us it has between 30 to 35% of its beds filled with COVID patients. We spoke with a doctor at St. Anthony's in Shawnee last week who says he's seen the state hit 0 available beds.
And then I realized after I made that list, I'm like, oh my God, this is bad. You know, nobody has any beds anywhere.
Stacy says right now the majority of the decisions on whether to cut back on procedures or adding additional beds is still being left up to hospitals. But if things get much worse, there are safeguards in place to add additional capacity through specialty care facilities.
We're ready to put in stronger interventions if we need to, but certainly we want to limit. To the extent possible, we want to limit any way we impact the freedoms of Oklahomans to continue to live their lives and just assure them that we have the resources to treat them should they get COVID.
Well, we do have a link to the surge plan inside this story on our website, KJRH.com. And coming up tonight at 10, what Stacy has to say about the possibility of building overflow field hospitals here in the state. Aaron Conrad, 2 Works for You.